Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is August 7th, 2020. As usual, we will go ahead and start with our COVID-19 statistics. Worldwide, we have nearly 20 million cases and over 720,000 deaths. In the United States, we have over 5 million cases and nearly 165,000 deaths. Today we want to address some concerns that have been raised about things that we've said in our past reports for the past month or so. Specifically, we'll be clarifying our stance on free speech, censorship, and the importance of accurate information. This past week, President Trump had a tweet removed due to inaccurate information about COVID-19. Many people complained that it was a violation of free speech or that it was unfair to single out the president. This also brings to mind the video from America's Frontline Doctors that was removed from social media last week due to false information. We talked a lot about that in the last report. Feel free to go back and watch that if you want more information about that. We here at Plain English Public Health believe that free speech is essential. The United States was built on a number of underlying principles, one of which was or is free speech. At the same time, however, we also believe that removing incorrect information about COVID-19 from social media is the right thing to do. Some of you may be wondering how we can hold both positions at the same time, so let me go ahead and explain. The laws of the United States recognize differences between valid free speech and misinformation. For example, when under oath in a court of law, a person must tell the truth or they will be charged with perjury. Even when not under oath, people can be charged with slander or libel if they lie about someone else. Yelling fire in a packed building, like a movie theater for example, when there isn't a fire, can get you arrested. So what's common to all these situations? Well, a couple things. First, all are instances of giving false information. Second, they can all hurt somebody else. It's not just yourself that you're hurting, it's hurting other people, and in most cases, multiple people. So how does this relate to the COVID-19 situation? Well, it should be obvious, but if someone lies or spreads misinformation about COVID-19, it could hurt people. If someone follows the misinformation given or ignores the correct information because of that other misinformation, they could catch COVID-19, they could spread it to someone else, or they could cause other bad side effects to happen if they're taking an incorrect treatment, for example. And as we've discussed in the past, COVID-19 is dangerous, not just because of deaths, but also because of other symptoms and side effects that can end up lasting a person's entire life, causing much harm that way. Now, just because we believe that misinformation should be removed doesn't mean that we want to suppress other opinions. In fact, scientists are typically some of the most open-minded people you'll meet, just because we know that anything or something could come along at any time and change what we currently think is the correct information. We stand behind the scientific method, however, and if something has been verified through multiple robust studies, we consider it to be true. So early on in the pandemic, we didn't have many studies to go off of. Because of that, the recommendations were based on what we knew about how other coronaviruses worked, other pandemics worked, things like that, and it was also based off of anecdotal evidence, things that were happening at the moment, things that doctors were telling us, other things like that. One example of that is with hydroxychloroquine. It became one of the major options for treatment early on, just because a few doctors said that they had seen, some of their patients become better after taking hydroxychloroquine. There had not yet been any studies to verify that, to get rid of any other factors that might be, the actual treatment that's happening, or maybe they were just, getting healed on their own, and hydroxychloroquine maybe didn't have anything to do with it. There weren't any studies at the time, and so we just kind of accepted it because we thought, well, we don't have anything else to go on. It sounds like it should work on paper, and we've had a few doctors say that it works for them. So we kind of went with it. Now, the actual studies have been done. A number of rigorous studies have been done that show that hydroxychloroquine does almost nothing to help with COVID-19, even when it's mixed with other drugs, other medicines. Much like America's Frontline Doctors were trying to say that you have to have zinc and zithromax combined with it. No, it's been tested. It doesn't work. But anyways, we have those studies now, and so we know more about hydroxychloroquine not working to help with COVID-19. In fact, we also know now that the side effects from taking hydroxychloroquine are more likely to harm you than COVID-19 is. So it's an absolutely terrible idea to take hydroxychloroquine. Just don't do it. We still don't know everything about COVID-19, but we know much, much more than before. Those who continue to push false treatments, or who insist on not wearing a face mask, or following the other guidelines that we've been given, are keeping us from making progress against COVID-19 as quickly as we could if everyone just united and did the simple, proven things that we've been asked to do. We've said this before. This is not about opinions. Opinions are subjective, meaning they are subject to a person's beliefs and experiences. Feel free to hold whatever opinions you want. You can change them as often as you'd like also. You can't force other people to have the same opinions as you, however. Facts, such as those gained from scientific studies, especially when the results of the studies have been verified multiple times through multiple studies, are objective. They are not subject to a person's beliefs. Truth is truth, no matter what you think of it. An example of that is the effectiveness of wearing face masks to stop the spread of COVID-19. We've had the studies now verified over and over again, not just in lab or clinical settings, but there have been actual real-life situations where specific states or counties or cities have implemented mask mandates, and within a few weeks, those specific locations have had their number of cases go down. For example, there have been some cities, Salt Lake City and Salt Lake County actually is one that comes to mind. They implemented a mask mandate. Their numbers went down, whereas other parts of Utah that were very similar but just did not have that mask mandate, their numbers did not go down to the same degree as those in Salt Lake City did. That's just one example of many throughout the United States and even the world of real-life situations that we've seen where wearing a face mask truly does work. So, since it can sometimes be difficult to determine which news sources are trustworthy, it's important to do your own research and figure out what is really true. Now, a lot of us are busy. We don't always have time to do in-depth research. That's why we have news organizations. That's why I do this. It's something that a lot of people face is a lack of time. So we here at Plain English Public Health want to make it a little bit easier, give you some suggestions. Please don't be offended by what we're going to say. But basically, if President Trump says something about COVID-19, it is most likely false. This isn't a reflection on anything else that he says or anything else that he's done. Feel free to listen to President Trump or anyone else that you want to listen to for any other topic. But President Trump has a very bad track record as far as accuracy when it comes to COVID-19. Please do not listen to President Trump for COVID-19 related information. A much better source of information would be the Centers for Disease Control, or CDC. Dr. Fauci is another good source. The World Health Organization, or WHO, is also a good source of information. Those are much better sources of information to get about COVID-19 than President Trump is. So please, let's listen to those that are actually giving us correct information, not incorrect information. Having said all that, we do want social media networks to be fair. Social media networks should be limiting or removing completely all the bad information, the incorrect information about COVID-19 based on its own merits or lack thereof, not based on who it's from, what political party it's from, or anything like that. It needs to be fair. Also, civil discussion about differing opinions on how to handle the pandemic should be encouraged. We need to have those discussions. Even though we have a lot of facts, moving forward and figuring out how best to do things, a lot of that, even though we have a lot of facts that can guide us in determining that, a lot of that is up to opinion, or we just don't have enough facts to get a specific thing. So we need to have that discussion. We need to know, we need to talk to people and get lots of different ideas and figure out what the best way is to move forward. So we should be encouraging that civil discussion. Also, we scientists also need to be more clear and open about information we have and how we got it. Knowledge is power, after all. And it's truly unfortunate that so many people have turned a public health issue into a political one. It really should never have been turned into a political issue at all. So, moving forward, in COVID-19 related news, schools across the United States have started reopening. Unfortunately, many schools have also started reporting cases of COVID-19, both among staff members and the students. Some of those schools have closed down again because of just too many cases showing up. The CDC has emphasized the need to reopen schools as much as possible because children need to be learning and they need to be socializing. But they have stressed that they do need to follow certain guidelines when they're opening. They need to be cautious in their opening and follow those guidelines. A few reports ago we went over some of those guidelines. You can also go to the CDC website to see more of those guidelines. Many schools, especially in states that haven't taken the pandemic seriously, are not following the guidelines and are pretending that all is normal. They're not doing well. Typically those that are not following the guidelines are having more cases. Also, summer camps are also reporting more cases among children and staff now. So it seems to be evident that children can pass COVID-19 to other children, to adults. They can spread COVID-19. This is something that we've got a little bit of information from studies on. Most of it is anecdotal though, so we definitely need to have more studies done. But it does seem, from what we are getting in reports and cases and all that, that children definitely can pass it to other people. Like I said, we do need more studies done, and more of those will most likely occur as more schools open up. There will be health departments tracking things and trying to get the information we need so we can make better decisions about how schools should open. So let's talk briefly about hand sanitizer. I know we've talked about this just about every week for, last month or two. But it still remains a topic in the news. First, the list of problematic hand sanitizers has grown. It's a little bit different this time because we do still have an extra number that have the methanol in them. That's been the problem, since we started talking about them, basically. But we also, this week, have some additions to the list of those problematic hand sanitizers, not because of methanol, but because of not having enough alcohol in them. We talked about before that you need to have at least 60% ethanol or 70% isopropyl alcohol in a hand sanitizer in order for it to work correctly. Now, these new hand sanitizers that were added to the list, they said that they reached those amounts, in the advertising and the packaging and everything, but in actual tests done, they did not. So you can look up the list. I've got a link down below the video, so feel free to look that list up and make sure that your hand sanitizer is not on that list. Again, like we've said multiple times before, try to stick with the known brands. It's getting a little bit easier to find them now. It used to be a lot harder, and that's why a lot of people started turning to these brands that were just popping up out of the woodwork, just trying to take advantage of the demand. But now that it's becoming a little easier to find known brands, please try and stick with those known brands. That doesn't mean you have to stick with the quote-unquote brand names. You can use a generic one, like a store brand or something like that. As long as it's something that you know is trustworthy, feel free to use it. Just try and stay away from those that are completely brand new, don't have anything else around. Just stick with the known ones. Secondly, about hand sanitizer, we want to stress the fact that hand sanitizer should be a backup, not the primary method of sanitizing your hands. Washing your hands with soap and water is the primary method. It just does a much better job at cleaning your hands, and we've talked about this in a previous report also, but it kills germs better, gets rid of them from your hands, doesn't just leave them sitting there, and it also helps to get rid of other things like dirt and chemicals and things like that hand sanitizer just doesn't do anything on. Also, we haven't heard of any soap that's been recalled for methanol or anything like that, so it's also safer. All right, so some other recalls we have this week. Several kinds of frozen taquitos and chimichangas have been recalled for possibly having plastic in them. The link to the full list of those brands is down below the video. Also, the Salmonella outbreak that we mentioned last week has now been linked to onions from Thompson International Incorporated. They are a large supplier, so the CDC recommends that if you're not sure where your onions came from, just throw them out to be safe. Also, the CDC warns that they expect an outbreak of acute flaccid myelitis this year. It's a rare condition that can result in paralysis or even death, but there tends to be an outbreak every other year, even though it's very rare. In 2018, there were 238 cases in the United States. We may have similar numbers this year. Acute flaccid myelitis mostly occurs in children. The main symptom to watch for is limb weakness. Sometimes it is preceded by fever or respiratory illness, and then you see the limb weakness. Other times it's just limb weakness and that's all you get. So it is very dangerous and it's hard to see sometimes, but please, parents, if you notice your children experiencing any limb weakness, please contact your doctor right away, because it can be very dangerous. Again, it's rare, nothing to be really worried about, but just keep an eye on your kids. Finally this week, the American Heart Association released a statement after extensive research of many previous studies on marijuana and its effect on the heart and lungs and other organs. Marijuana has been shown to interfere with other medications and to cause heart attacks and strokes. It can also cause harm to the lungs, the blood vessels, and heart. The AHA did say that the studies focused mostly on THC, the psychoactive component of marijuana. That chemical is the one causing the majority of these problems. Another contributing cause when smoking marijuana is the tar and carbon monoxide deposited in the lungs and blood. CBD, the non-hallucinogenic part of marijuana, seemed to show a possible protective effect on the heart and blood vessels, actually, but they did say that more studies need to be done to verify those findings. Those are very, very initial findings, and they just haven't had enough studying done on the CBD part to recommend using it at this point. The AHA recommends avoiding smoking or vaping any product, whether it's marijuana, cigarettes, any type of chemical of any sort. Smoking and vaping just is not recommended at all, because it does have side effects regardless of what you're smoking or vaping. So while marijuana may have medical purposes, it is important to review all available options before taking a drug that is known to have negative side effects on the heart and other organs, such as marijuana does. The narrative that marijuana is harmless is absolutely false. It is similar to other drugs, natural or synthetic, in that it may have good effects, but it also has negative effects. So we do need more research to be done in order to determine whether marijuana, or even just parts of it, are actually worth using. Thank you for watching the Plain English Public Health Weekly Report for August 7th, 2020. I'm Richard Greenland, and you have a nice, healthy weekend.